Hello everyone. Today we're going to talk about pain sedation questions. Part of the reason for doing this is you need to know when is it acceptable to give opioids and when is it not acceptable. And this is a scale that's been adopted um, in relation to opioid IV administration by nurses. So in looking at the Passero pain scale, it looks at a couple of things. It's actually called the pain sedation scale. So it has 5 main points. Number one, someone's asleep. The key here is that they're easy to arouse. So all you have to say is walk in the room and speak their name, for instance. You may administer opioids if necessary, if they have pain. Second level is that they're awake and alert. You can obviously give them opioids in this case. The third level is they're slightly drowsy. You can give them opioids here. The next level is that they're frequently drowsy. Here's where you have to be careful. If they're frequently drowsy, but they're arousable, but the key is that they drift off during conversation, you cannot administer an opioid at this point in time. Okay? So they drift off to sleep during conversation. And then the fourth level is that they're somnolent. In other words, there's minimal or no response to physical stimulation. So you go up to them, they're very, very sleepy. You obviously cannot give them any opioids here because you'll just cause them to go into respiratory depression. So a couple of things that you have to remember. When you are giving opioids or pain, period, it's important to know that usually pain meds will be prescribed at 3 different levels for minimal pain, moderate pain, and severe pain. Usually opioids are given for severe pain, but you have to think of some other things that's going on. Can the patient eat? What route is available? So obviously if you know they're NPO, you can't give them something oral. What's their pain goal? So what's really going on? What's their goal? What's their sedation level? And that speaks to the Passero sedation scale. What is their level of pain? So is it a 9 out of 10? And are they opioid naive? If they are, they're actually going to respond differently than someone who's had opioids before. So here's a sample order set. Notice we have 3 things here. We have Tylenol, hydromorphone, and morphine. So you'll notice that one is an IV route, which is morphine, which is for severe pain. Hydromorphone, which is for moderate to severe pain, and Tylenol. So here's the scenario. At 10 a.m., Mrs. Sick is a patient that's NPO for a procedure later. She complains of foot pain. Well, the only thing she truly can get is IV morphine. Knowing from what you know already, we're going to start at the lowest amount. So she's going to get 1 milligram, and you're going to check to see her pain rating in 10 minutes. So at 10:10, she has a pain of 6 out of 10. Her pain goal's 2 out of 10. What should she get? She's a little drowsy. So she's talking to you, she tells you her pain, she can get another milligram, okay? And you're going to check again in 10 minutes. Now it's 11 o'clock and she complains of pain again. She's 7 out of 10. She's alert and talking. How much pain medicine should she get? Well, since it took 2 milligrams to reach her pain goal last hour, she can get a total of 2 milligrams because that worked. Okay, it's 2 o'clock now. She's back from her procedure and she can now eat. She's complaining of severe pain, 9 out of 10. Well, this is a little tricky. She can eat and she has severe pain. So you could give her the 2 milligrams of morphine that worked for her earlier. It's now 5 o'clock and she complains of headache and she's spiking a small fever of 101.5. So the best choice here would be to give her her Tylenol. At 8 o'clock, she complains of severe pain, 10 out of 10. What should she get? Again, for severe pain, we could give the morphine. You could also give the hydromorphone. But in this case, we're going to give them morphine. So we're going to give her 2 milligrams, since that's what helped her before. 10 minutes, we check her again. She's still complaining of pain. 7 out of 10. Now remember, she has a max range of 4 milligrams, so you can give her another 1 milligram. It's now 8:20, and she says she has pain, but she drifts off to sleep. What should she get? So here, we would actually hold the pain medicine because she can't stay awake. So she would not get anything. Alright, so in looking at the pain sedation scale, you want to look at a few things. Not only a patient's pain goal, whether they're easily arousable. You can also look at their respiratory rate, and that would be an astute thing to do as well. Anything for a respiratory rate under 8 or 10 breaths per minute, I definitely hold any opioids. Okay, I hope this was helpful. Have a great day.